Hello, I'm Simon Howard from the North East Health Protection team, and this is the second of our videos of questions and answers for North East schools and COVID-19. If you haven't seen the original webinar or you want to see the other questions and answers videos, look in the description for this video. This one is all about the infectious period, so the questions we've received on that theme. And let's have a look at the questions. First one is, if a school pupil became unwell on Saturday after having attended school earlier in the week, does this represent a risk of transmission? The answer to that is yes. The infectious period starts 2 days before the onset of symptoms and lasts until 10 days after the symptoms started. So anyone they've been in close contact with during that time would need to be excluded from school and would need to self-isolate. If a pupil or member of staff developed symptoms late on Sunday and was in school on the Friday, would you consider them to have been in school during the infectious period, even if this was more than 48 hours after their last attendance? That's a slightly tricky question. So technically no, because they are more than 48 hours afterwards, but from a clinical point of view, I'd be skeptical that people could be that precise about the onset of their symptoms. And if there's any doubt at all, I would err on the side of caution and of being more protective and include the Friday in their infectious period as well. Often in health protection, when we're dealing with other diseases, we take the whole day rather than looking at the individual time periods, because it can be quite hard to know exactly when some of these symptoms started. So, for example, you don't necessarily know the first time you coughed down to the hour. So technically this person would not need to consider their Friday as part of that infectious period, but I would be minded to err on the side of caution if there's any uncertainty at all about the exact point at which the symptoms started. What time period do we need to go back to assess for close contact if the test result is delayed or the timeline includes a weekend? The test result being delayed or the timeline including weekend makes absolutely no difference. You go from 2 days prior to the onset of symptoms to 10 days afterwards, and close contacts within that time count. So even if the test result is delayed, you still go back to 2 days prior to the onset of symptoms. People who don't have symptoms shouldn't be tested, but in the unlikely event that somebody who has no symptoms does get tested and is positive, then you go back from 2 days from the test date to 10 days after the test date. Where a child develops symptoms of a sore throat on Friday, then a cough the following Tuesday, how do we calculate when the infectious period starts and the period of isolation ends for the child? So again, there's a little bit of judgment needed here. We say the symptoms started on the day that their period of illness started. So if they had, like this says, a sore throat, and then a couple of days later got one of those cardinal symptoms of a fever, a new continuous cough, or a loss of or change in taste, sense of taste or smell, I would go back to the beginning of that period of illness, so the start of that sore throat. There's a little bit of judgment. If someone's had a bad back for 5 years, that doesn't count. You would go from the start of their symptoms. But if it's a single discrete period of illness that sounds like a viral illness, then I would go 2 days back from the start of those symptoms. Ideally, to be extra safe, I would then say that their isolation period ends 10 days after the start of their actual COVID symptoms. So that person would be isolated for more than 10 days because they've got Friday, Saturday, and Sunday when they didn't have COVID symptoms that we're including. So the answer is you start your infectious period 2 days prior to the onset of symptoms of the current illness, and your infectious period ends 10 days after the start of COVID symptoms. And that's all the questions we got on testing. As I say, for the other sections of these questions and answers, please look at the description below. And for the original webinar, you can find a link to that in the description below as well. Thank you.